Welcome to Biological and Psychosocial Risk Factors. In this session, we will focusing on biological and psychosocial risks that affect health and safety at work and the measures to control them. At the end of this training, participants will have knowledge about biological and psychosocial risk factors that negatively affect workplace health and safety, and about the occupational health and safety measures that should be taken against these factors. By the end of this program, you will be able to explain biological risk factors, perform risk identification and assessment, outline the employer's responsibilities regarding biological factors, summarize hygiene and personal protection, recognize jobs where exposure to biological agents may occur, and identify psychosocial risk factors. Biological agents include bacteria, viruses, parasites, and fungi. These agents can be present in the workplace and may harm health if appropriate controls are not in place. They can cause infection, allergy, or poisoning. Biological agents are classified into four risk groups based on infection risk level: Group 1, Group 2, Group 3, and Group 4. Control measures scale with the risk group to protect workers' health. Risk assessment and required precautions are determined by considering the type, level, and duration of exposure. If multiple groups of factors are present, the assessment considers the combined hazard they create. The risk assessment is updated whenever any change could affect workers' exposure conditions to biological hazards. The classification of biological agents that are harmful or potentially harmful to human health. Recommendations of the competent authorities on controlling biological agents to protect workers' health. Information on diseases that may arise from the work performed, and information on allergic or toxic effects that may occur as a result of work. The employer shall avoid using harmful biological agents depending on the work performed and, in light of current knowledge, replace them with agents that are not hazardous or less hazardous to workers' health, taking into account the conditions of use. The employer shall take measures to reduce the risk of exposure to biological agents in the workplace. If the risk assessment shows exposure poses a risk to health and safety, the employer shall prevent such exposure. Measures to minimize exposure include keeping the number of exposed or potentially exposed workers to a minimum, implementing work processes and technical controls to prevent the spread of biological agents, applying collective protection measures and PPE, preventing uncontrolled leakage of biological agents, using biological hazard signs and other signs, preparing a plan to prevent accidents involving biological agents, conducting workplace environment measurements, establishing waste management, and arranging the safe transportation of biological agents within the workplace. The employer shall notify the Ministry of the results of the risk assessment, jobs where employees are exposed or likely to be exposed, the number of exposed employees, the name, surname, title, and qualifications of persons responsible for OHS, the protective and preventive measures taken, including the nature of work and methods, and the emergency action plan to protect employees from exposure resulting from the removal of physical protective measures against Group 3 or Group 4 biological agents. The employer shall immediately notify the Ministry of Labor and the Ministry of Health of any accident or incident that may cause the spread of a biological agent into the environment and result in serious infection and/or illness in humans. Upon the cessation of the business activity, the list of exposed workers and all medical records kept shall be submitted to the Provincial Directorate of Labor and Social Security. Hygiene practices include engineering measures, e.g., waste collection, ventilation, Operational measures, e.g., safe transportation, management of sharp instruments, pest control and sterilization, and the use of PPE shoes, gloves, goggles, masks, caps, boots, etc. Nothing shall be eaten or drunk in work areas where there is a risk of contamination. Workers will be provided with appropriate protective clothing or other suitable special clothing. For human and animal samples, sample collection, processing, and examination procedures will be determined. Work clothing and protective equipment that may be contaminated shall be kept upon leaving the work area and stored separately from other clothing. The employer shall ensure decontamination and cleaning of contaminated clothing and PPE and dispose of them when necessary. The cost of these measures shall not be passed on to the workers. Trainings taken by the workers for potential health risks, measures to prevent exposure, hygiene requirements, use and wearing of protective equipment and clothing, and actions will be extremely useful in the event of an incident and to prevent incidents. Training shall be provided before starting work involving contact with biological agents, adapted to new or changing risks, and repeated periodically as necessary. Employers shall immediately notify employees and/or their representatives in the event of a situation affecting health and safety that could cause serious infection and/or illness in humans. Additionally, employers shall inform employees and/or their representatives about the measures taken to rectify the situation as soon as possible. Every employee has the right to access information on the list that pertains to them personally. Employees and/or their representatives shall be given access to relevant information. For Group 3/Group 4 exposure, the following shall be kept: list of workers, type of work performed, biological agents to which workers are exposed, exposures, and records of accidents and incidents. This list and record shall be kept for at least 15 years after exposure ends. Storage for at least 40 years after last exposure applies to exposure to agents that cause persistent/latent infection, exposure to agents that, based on available information, cannot be diagnosed until years later, exposure to agents with a long incubation period before disease onset, exposure resulting in recurrent diseases despite treatment, exposure to agents capable of causing serious long-term damage. Prior notification shall be provided for the first use of the following: Group 2, Group 3, and Group 4 biological agents. This notification must be made at least 30 days prior to the start of the work. If there are significant changes in the process and/or operations that may affect health or safety, the notification must be resubmitted. The employer shall ensure that each employee is subject to health surveillance before commencing work and at regular intervals. Risk assessment will identify employees who require special protective measures. Where necessary, effective vaccines are made available for employees exposed or potentially exposed. If a worker contracts an illness as a result of exposure, other workers are also subject to monitoring. In such cases, the exposure risk is reassessed. Personal medical records shall be kept for at least 15 years after exposure has ceased. The occupational physician provides recommendations regarding protective and preventive measures for each employee. Employees are given information and advice on health monitoring to be conducted after exposure has ceased. Employees may obtain information about health surveillance results. Employers may request a review of these results. Any disease or death resulting from occupational exposure to biological agents is reported to the Ministry of Labor. In risk assessment, consider uncertainty regarding the presence of biological agents in humans or animals and in substances and samples obtained from them. The hazard posed by biological agents known to be present or suspected to be present in patients and materials/samples obtained from them. and risks inherent in the nature of the work. Appropriate measures to protect workers' health and safety include determining appropriate decontamination and disinfection methods, using appropriate methods to ensure waste contaminated with biological agents is loaded, unloaded, and disposed of safely, and in quarantine areas where infected or suspected patients/animals are present, taking the measures in Annex VA to minimize infection risk. In laboratories where research, development, teaching, or diagnosis is carried out and there is a risk of being infected with Group 2, 3, or 4 biological agents, the measures in Annex V shall be implemented to minimize infection risk. Following a risk assessment, the physical protection level must be determined according to the nature of the work and the biological agent, and the Annex V measures shall be applied. In laboratories where substances whose potential to cause human disease is uncertain are handled, while the primary purpose is not to work with such agents, at least protection level 2 measures shall be implemented. Unless the ministry specifies that lower-level protection is sufficient, level 3 or 4 measures are implemented where necessary or suspected. The occupational physician responsible for health surveillance of workers exposed or likely to be exposed must be aware of each worker's condition and exposure. Surveillance is conducted according to occupational medicine practices and includes keeping records of the worker's occupational and medical history, assessing personal health status, biological monitoring, e.g., detecting early reversible effects if appropriate. Further examinations may be decided during surveillance in light of the latest information. The measures listed in Annex V shall be applied according to the risk, the nature of the activities, and the relevant biological agent. Those exposed to biological agents will be vaccinated if an effective vaccine is available. Vaccination must be carried out in accordance with relevant legislation and practices. Workers will be informed about the risks and benefits of vaccination and non-vaccination. A vaccination certificate for the worker will be issued for presentation to authorized persons upon request. The cost of vaccination will not be borne by the employee. The importance of job design and work organization management, and the social and environmental conditions in which the work takes place. These factors directly affect the mental and social well-being of employees. Exposure to physical and psychosocial hazards can affect psychological and physical health. These effects manifest themselves in at least 2 ways. Direct physical pathway, through psychological stress. These 2 pathways are not mutually exclusive. Rather, in most cases, they occur together and interact with each other, complementing or reinforcing each other's effects. Psychosocial risk factors include work environment, working hours, wages, managerial and employee-related factors, daycare/nursery, etc., pregnant and breastfeeding employees, young employees, harassment, stress, discrimination, and pressure. Psychosocial risks in the workplace involve relationships among employees and directly affect their mental and social well-being. Factors include work environment, working hours, wages, managerial and employee-related factors, unionization. According to the World Health Organization (WHO), work-related stress is the response of an employee to demands and pressures that exceed their knowledge, skills, and coping capacity. Insufficient support from colleagues and employers, and lack of control over work-related tasks can lead to negative outcomes. Pressure and competition are often confused and sometimes used interchangeably. Pressure at work. When it is at an appropriate level for the employee's skills and resources, it allows control of work, enables support from other employees, and increases productivity. There should be no factors at the workplace that threaten health, and conditions should facilitate the promotion of health. Stress in the workplace can cause poor work organization, poor and ineffective management, unsuitable working conditions, insufficient support from superiors,